Good morning, everybody, and welcome to Breakout Session E2, Nudging the Industry, Nudging Ourselves, which will be a continuation of the conversation that we just had on the main stage with our fabulous panelists. They'll be back here, so you can hear more from them, and if you have any questions for them, please feel free to put it in the chat, or time permitting, you may be able to come on stage with them, but be sure to have those questions ready. So with that, I'm going to introduce our moderator for the breakout session today, Chavanne Hanson, who is the Food Choice Architecture and Nutrition Manager at Google Food, as well as the Vice Chair of the Menus of Change Business Leadership Council. Welcome, Chavanne.
Thank you so much, Katie. Great to be with you. And really nice to be able to dig a little deeper into just coming off of the main stage session. Today, Nudging the Industry, Nudging Ourselves, we'll take a little deeper dive into some of the topics that were raised by the panelists. Today, we want to explore just a little bit deeper into three kind of key areas: how leaders in city government can work with chefs in the restaurant community to improve food choices and food access for all Americans; how legislation and regulatory change in DC and other world capitals over the next several years might affect our food system and nudge businesses as well as consumers. And the question, do we know enough about how creating a successful change in food behavior to inform public health and corporate strategy? There's a lot going on in the industry, and we've got an industry lead to be able to talk to us a little bit more about that. So these questions and more we'll raise today. I want to bring up the panelist, Sara Bleich, Professor of Public Health Policy from the Harvard Chan School of Public Health; Kate McKenzie, Director of the Office of Food Policy in the Mayor's Office from New York City; and Emmeline Fallis, Director of FRESH with the World Business Council on Sustainable Development; and last but not least, Jerry Mann, Senior Advisor to the President at CSPI and Adjunct Professor of Nutrition at Harvard School of Public Health. Welcome, everybody. Great main stage session. It was great to hear the dialogue and discussion, and I think you all really were able to just touch the tip of the iceberg, I think, with a lot of the conversations, and we'd like to go just a little deeper. This time is going to fly for sure, and we'll just welcome questions from the audience that may pop up. But let me start off with a quick question for each of you, and we'll just go through and try to do some rapid fire responses. But I want to get a sense from each of you. Not that 5 years from now is the end by any stretch. We've got a big, bright future ahead of us. But what do you see as success in the course of the next 5 years? What are we chasing after? What do you want to see accomplished in the next 5 years from each of your areas of expertise and your vantage point? Sara, I'm going to give you a little break since you did all of the leading of the last session. I'll let you go last. But Emmeline, let me start with you from the vantage point of the industry. What do you want to see as success in the next 5 years?
So I think there are several things that I would love to see. As I was explaining in the main session, actually, first of all, we really need the way we eat today and the way we also produce. So the whole food system needs to change towards a system that is sustainable and healthy. So what does that mean? I'm not going to cover everything here, but like I said, from a dietary point of view, we really need to change the way the plate or the bowl are composed to make sure that there is a better share of different types of proteins, that there are more plants in there, and that for what comes to starches, we actually have more whole grains. So that's one thing. We also need to make sure that whatever more processed food we eat has a good nutrition in it. So we reduce the less desirable aspects like salt, sugar, and trans fat, and we increase the great things that are in food and that we need to survive, which are nutriments, etc. But also, I think I would like to, on a wider scale, I would like to see food to be considered again by people the way it should be, which is it's a central part of our culture, and therefore we need to spend time preparing it, eating it, and really enjoying that, because I think if we are starting to eat, the wrong things the wrong way and way too much, or when we can afford it, it's because we've lost a bit that connection to how important and fantastic the food can be. That's one. Then, of course, this is about Westerners that often have access to a lot of food. But we saw with COVID-19 that, first of all, it's not the case for all Westerners anymore. And in any case, that actually hunger is going to rise right now. So the other side of the coin is that we would need everyone to be able to access healthy and sustainable food. And today, not all food is affordable. And often, unfortunately, the more healthy and more sustainable food is even less affordable. So that's where we need policymakers to really chip in and act, because they need to be able to change the policy system in order to really encourage and support this shift in production and consumption.
Lots of rich insights there. Thank you, Emmeline. So composition of the plate, nutrient density, the investment people spend in preparing food, and the affordability, accessibility of that food. So thank you for that. Jerry, what do you have to add from your vantage point? What does success look like for you?
First, that the Department of Agriculture's food and nutrition programs would become public health programs, or viewed that way in their structure and organization. We had a remarkable experience years ago when USDA was doing food safety more as an administrative task, and when it sort of married the public health approaches that FDA took with its work, we saw some of the worst foodborne illnesses, E. coli 0157, for example, dropped from 8 cases to 100,000 to 1 by taking USDA's extraordinary resources and matching it to a public health approach. Likewise, that $100 billion investment that USDA makes each year in purchasing food for people, or helping them purchase food, that touches 1 in 4 Americans. If a greater emphasis was put on the healthiness of that food and the sustainability of that food, it would have an enormous impact. The other one I'll mention is that there'll be a National Institute of Nutrition at NIH. And it's shocking that there isn't. It's less than 5% of the NIH budget, yet it's the largest driver of the work that the other institutes do. So whether it's heart disease, cancer, diabetes, and digestive diseases, they're spending billions and billions more dealing with the diseases caused by diet, but we don't have the right support for the nutrition to support. And let me give you an example of why that is so important. So, the counterfactual, imagine if decades ago, if our scientists in nutrition weren't just funded by the Heart Institute and the Cancer Institute, but by a National Institute of Nutrition. Imagine then if out of that Heart Institute, for example, people came forward and said, gee, in the nutrition studies we're doing, where we look every day through a lens of heart disease, we think lowering fat in the diet is the most important thing. Had there been a National Institute of Nutrition and that they ran over there and said, well, we have this finding, we need to immediately lower fat in the diet. Maybe that National Institute of Nutrition that was taking a more broader view of nutrition and health said, no, we've seen that signal as well, but if you lower the fat, what else is going to happen in the overall diet? And this would have dire consequences for our friends over at the Diabetes Institute, for example. And so I think the fact that our focus on nutrition in the National Institutes of Health is only 5%, and even then through lenses of specific diseases, has been an enormous disservice to the nation.
Jerry, thank you for that. Really quickly, how can people get more information about this National Institute of Nutrition that you're proposing? I know that there's been a lot of discussion and you have been a big part of those discussions, but how can people learn more?
Sure. My previous place at Tufts University just put out a white paper that people can get, that we can make access to it, that sort of lays out as part of that. It gets into other issues of coordination of nutrition as well. But the case for a National Institute of Nutrition is clearly made there, and the need for this type of coordinated nutrition is also in the 50th anniversary conference report we did. But if we can get people that white paper, I think it does a great job sort of laying out the concern.
Fabulous. Thank you for that. Kate, how about from your side?
So much to build from here. I think one of the things that certainly the COVID-19 crisis has brought front and center is And we knew this before, but the undescribable inequity in how food and food access, the reality of that across the country, and in particular in New York City, I can speak to. I'd like to see in 5 years, and building a bit on what Jerry was saying, there's going to be so many opportunities for supports, right? Whether they're business supports, God help us, and I hope that we have another sort of economic stimulus package coming imminently, and connecting these threads again of business supports to health, to food insecurity, for win-win solutions, certainly for the business communities as well as our most vulnerable residents. And I see that could take the form certainly as connections even to healthcare, and we can really drive home the food as medicine element that is about ensuring that people who are in hospitals, who are afraid to even go to hospitals right now because of the realities of the last several months, and what will continue to be the case for a long time, but really seeing as a hospital that has access points to great food opportunities, and connecting that again to the food establishments at hospitals and beyond that. And the other thing I would just like to say is that really this sort of circularity of food, and as that relates certainly to ensuring that we are preventing food waste, but also again the cycle here of how our true most vulnerable Americans served through the emergency food system, how the food coming into that system can be strengthened and really align with those dietary guidelines, certainly, but not really try to make sure that businesses are incented for their donations, even greater values for healthier products, so that we can make sure, again, that those people who are not just suffering from hunger and food insecurity, but certainly those that are also highly likely to be compounded with diet-related diseases and diabetes and obesity, certainly, are treated well with the food choices available at their emergency food networks. So again, there's these sort of elements all coming together and connected through strong public policy that benefit sort of the triple bottom line, and not just one sector over another.
Thank you for that, Kate. I know you're deeply involved with the Ellen MacArthur Foundation and the work on circular economy of food. So that really great perspective. I think that's an important contribution. So thanks for that. And Sara, over to you in terms of success in 5 years. What would you like to see?
Yeah, well, with my public health hat, which is sort of the vantage point that I sit from, I would say that success in 5 years means more equitable public health. And I think we can achieve that in three main ways. Sort of as Kate was saying, the thing that COVID-19 has done it has just highlighted the haves and the have-nots. It has brought hunger out of the shadows. It has made a lot of people realize that many people for the first time are suffering from hunger. And many people are realizing that you can walk into a grocery store a few months ago and not be able to buy bread, something that probably people had never experienced before. So access is now front and center. And so I think that if we have in 5 years a more equitable public health system, three key things have to change. One, and this is the point that Jerry pushed on already, is that we have to modernize the existing federal programs to meet today's needs. So that means we can't just focus on food insecurity. We have to also focus on the public health issue of poor diet. So we don't just want to feed people calories, we want to feed them good calories. We also want to think about, right now, there's been a massive shift to allowing SNAP benefits to be able to be used online. WIC is still moving in that direction. There's no reason why you shouldn't be able to purchase things online if you're a recipient of these programs, in part because of the more immediate risk mitigation, but also because it shouldn't be harder for you to shop because you happen to be a low-income person receiving benefits from the federal government. The second thing is I think that public health needs to continue to bridge to the restaurant industry. All progress does not need to happen through regulation. I think a lot can happen through voluntary and public-private partnerships, and thinking through where are the sweet spots and what makes sense and how do we push these agendas forward. For many people on this call, there's a lot of interest in sustainability, in plant-forward diets. Those are important pillars of public health as well. And I think we can sort of find where we can meet in the middle of that bridge and push ideas forward that don't require the heavy hand of regulation. And I would say the third is that if we have equitable public health, we have to have a more responsive system. One of the things that has made the reaction to COVID-19 so hard is that some programs like SNAP are designed to respond to these economic fluctuations. Other programs are not, like unemployment benefits. And so just trying to, in the wake of these massive stimulus programs, which are so important, just trying to get benefits into the hands of people that need them has been challenged by just the systems that are in place. And so thinking about how do we change the systems to just grease the wheels so that as things happen to the economy, as it contracts, as other infections crop up, we can really help people who need it most as quickly as possible.
Thank you, Sara. Can you give us an example of the partnerships that you're talking about to really see some of this come to life, that you have seen some successes? Is there one that comes to mind that you could highlight for us?
Well, I would say that menus of change is one of them. I mean, there are many, probably hundreds of people on this call that represent portions of the restaurant industry that are not just thinking about the bottom line in terms of the financial bottom line, but also thinking about, how do you have a sustainable product that can be in the marketplace for a long time and at the same time promote the public's health. And so I think this platform is a really important partnership between public health and the restaurant industry and advocates to sort of be moving in the same direction to push ideas forward. And I think that you could also look at healthy beverage ordinances. I mean, that was something which first was pushed by restaurants like McDonald's and Burger King, and the decision to pull unhealthy beverages out of kids' meals. That was voluntary, and since up by ordinances, but that doesn't mean that more voluntary actions can't still happen.
Super, thank you for that. Emmeline, I want to come over to you to talk a little bit about consumer behavior change. What are you talking about within Project Fresh to help us identify where consumer behaviors need to change, or what kind of research is there that's really helping your companies make the changes necessary? And what are some of the barriers too when it comes to consumer behavior change that you're grappling with?
Sure, thank you. Well, what we know is that there has been quite a number of tests all over the world, either launched by governments or local city mayors, or actually by retailers or other companies to look at how can we change consumer behavior. Some of those pilots have had some success, and some of them have not had much success. In fact, Sara was sharing some data about this in the earlier session, where we see that actually using front of pack has had limited success in terms of how much reduction of calories it has led to, for instance. So what we're looking at is understanding why such limit to success. And what we find out is that people are actually facing a number of hurdles and also need a number of levers to be activated in order to really change the way they're eating. It's not just about affordability for most of the cases. It's not just about trendiness. It's a number of factors that include the feeling of belonging to a group, the feeling of having the skills and knowing how to cook, as I was saying, the attractiveness of the food. It's all of those different factors that need to be really aligned in order to get people to want to change the way they've been raised or they've been eating for the last many years. So what we're doing within Fresh, indeed, as you kindly mentioned, Chavanne, of which Google is a member, but a lot of other companies across the value chain are members, is that we're looking at how can we together try to align those factors to really change the food that we're presenting, the marketing that goes behind, but also the food environment. So the way the retailers or the restaurants actually display and market a type of food has a big impact. We know from an example, a work that was done by WRI, that actually on the same kind of a menu, if you actually label a dish with the name vegetarian, people will take it way less than if it's this mixed with the other dishes, but is not labeled as vegetarian. So there is a lot of learning to do in terms of the communication, but also, as I said, the food environment, the reformulation that we can do, the marketing, and this is what we're trying to achieve in this project, working all together hand in hand with the policymakers. This is also really critical, as I was saying before, really having everyone to work hand in hand towards achieving that change that is difficult to achieve.
Super, thank you. I'm curious, Kate, Jerry, or Sara, do you have any other thoughts around consumer behavior change that you might even be thinking about that could be shared back with the industry? What are you all grappling with, or what are you thinking about or trying to digest as it relates to consumer behavior change? Because the industry at the end of the day is preparing a lot and manufacturing a lot of these foods. What should they be thinking about?
I can take a stab at that,
Sure.
Chavanne. So from where I sit, and this Jerry sort of made this point earlier, on one hand, there are mountains of public health research which say public or consumer behavior is very resistant to change. So once you've decided you like a certain brand or a certain restaurant, like you go there repeatedly because that's what you know, and we're very powerfully motivated by defaults. But that doesn't mean that you can't modify consumer behavior in a sustainable way. And I think from where I sit, one of the key ways to do that is to not wag my finger at an individual and say, don't do this, don't do that, but to rather create an environment that raises up barriers to unhealthy food and brings down barriers to healthy food. And so those are some of the things we talked about on the main stage. Policy can play that role, like sugary beverage taxes or menu labeling. But it's also the case that non-regulatory options can also play that role. And so restaurants can choose to push certain items on their menu. So for example, imagine if every single restaurant listening right now said, we're no longer going to offer sugary beverages. We're going to offer a seltzer stream instead with many flavors. Imagine the number of calories that would be pulled immediately out of people's diets. And I'm guessing that people could probably quickly adapt. Seltzer has become the darling of the beverage aisle. Why can't it happen in restaurants? And I've talked to some restaurants about this, and it sounds like there's some concern that people may not want to pay money for water with bubbles. And I get that. There's obviously financial concerns, but I think there are areas to innovate. I think another area to innovate for restaurants is understanding that the core of the menu probably can't change for brand reasons. Why not do innovative things with sides? Like, doesn't always have to be things like French fries. It can be different types of fried vegetables like zucchini or broccoli. And so I think there's lots of things that can happen that don't interfere with sort of the core of restaurants have a fiduciary responsibility. In public health, obviously we want to maximize health, but there are sweet spots. And I think we have to just keep searching for those sweet spots.
Thank you. That's fantastic. Very inspiring. Kate, Jerry, anything?
I would just like to say, New York helped to start actually the Urban School Food Alliance, right, which is the entity that the large school districts are all a part of to try and rally their buying power. And something that's particularly vexing to the New York school district, and as a mother of two school students in that system, they really wholeheartedly have embraced meatless Mondays. And overall reductions in animal proteins. They are really struggling to find options that are palatable for kids, and to make sure that it isn't certainly then swinging the spectrum then and consuming a very high fat option at the same time. So I think that there's an option. Again, this is not necessarily in the restaurant space per se, but sort of in the food industry writ large. Options, we need to make sure that kids eat, and need to make sure that again, all of this doesn't end up in the compost bin, but that there can be some palatable options for kids that are aligned with the USDA recommendations for school meals, but that are more plant forward.
Great. So innovation is a big opportunity. And I love the notion too, Sara, that you're talking about, just really stimulating the industry and all of the players to come together to create these solutions together. There's big opportunity and just a meeting of the minds and sharing where the opportunities sit. Jerry, did you have something? Oh, sorry.
Yeah, I mean, I think that making these choices healthy, sustainable, delicious, not just easy, but delicious is what you all in the food service industry and as chefs know how to do better than anyone, and we need much more of it. For example, as Kate was talking about the school setting, experience both in Boston and by a chef in a company brigade in Connecticut, chefs helping more with school meals, trying to make sure they're delicious for kids, achieved two things. One, made a healthier, sustainable food much more popular in those schools, but also brought down the cost sufficiently that chefs could be hired by scratch cooking and other techniques. So I think delicious is a big part, and it's how food should be. It should be a pleasure, it should be a joy, and there's no reason that is in conflict, and I think in too many people's mind it is. Also, from your perspective in the food service industry, helping those of us who set policy know where the barriers are or where the incentives may be. And so, Sara, we've talked about maybe it's taxes. What are the things that are that? But you have a better vantage point there in the food service industry as you try to do what you do. What are the things that you feel are barriers, or things that could be incentives in addition to the ones that we've thought of? Would love to hear about.
Sara, you had a point you wanted to make. I'm sorry.
No, not at all. I just wanted to build on what Kate was saying about the school meal program and the role of sustainability. And there just underline the idea that in some cases, policy sort of takes a back seat. In other cases, policy is front and center. So in the case of school meals, the school breakfast and school lunch program, the architecture of them is the dietary guidelines. And because the dietary guidelines are silent on sustainability, it then makes it very hard to create these more sustainable menus that you'd want kids to be eating. And so some of this is just trying to find, how do you get the policies to meet where the science is going and where the industry is going. And that's an area that's pretty politicized and needs more work.
Thank you. Well, I know Katie has popped up on our screen to signal the closure of this session. She's going to give us a few logistics, and I'm just going to have our panelists start to think about a top takeaway from this session in 6 words or less. So if you can start to formulate your thoughts, there's been so much rich information and exchange, so I thank you for that. But Katie, over to you.
Thank you so much, Chavanne and panelists. As Chavanne said, please don't leave. We have some great takeaways from our panelists coming up. But I just wanted to give you a couple announcements about our upcoming break so you know what you can enjoy during that time. So our break sponsor today is Oatly, and they will have a culinary demo about plant-forward cuisine that you can find in the sessions tab. So take a look at that. You'll also have opportunities for one-on-one networking. It'll be about 4-minute meetings, sort of chance encounters with your peers. So feel free to click on the networking tab there. There will also be an expo where you can go to sponsor booths and see different culinary demos, videos, presentations about trends. So definitely take a look at that. And just one reminder that by engaging in these activities, you'll have a chance to win prizes. We give out a book by our authors, sometimes a cookbook, sometimes a policy book, every week. And if you engage for all 6 weeks, you have the chance to win travel and a ticket to Menus of Change 2021 in Hyde Park. So please enjoy yourself during the break. And with that, passing it back to Chavanne.
Thank you so much, Katie. Okay, so let's just do a quick round. 6 words or less, your top takeaway from this session. What would you like to leave with everyone? This is a bit of a challenge, I know, for us. It's hard in 6 words, but Sara, do you want to start us off?
Sure, and I'll preface this by saying a lot is 2 words. And so my 6 words are food policy can matter a lot.
Great. Kate?
Inclusivity and healthy food justice.
Super. Jerry?
Make the healthy, sustainable choice delicious.
And Emmeline?
You stole mine. Okay, I'll find another one. Healthy and sustainable diets, but also let's think of reducing waste.
Super, thank you. Well, for me, it's all sectors make a difference in better health. And I just want to thank each of you so much for your contributions, for all you do for public health, and coming together today just to share your insights, your expertise. It's been a great session, and we really appreciate your time and expertise. Katie, over to you.
Thank you so much to the panelists. And with that, please, everybody, enjoy your networking break And we hope to see you again very soon. Thanks so much.